And I feel like that's part of my life's work as a professional, is to get groups of people in spaces together that would otherwise never share them.
Right.
You know what I mean? So like the Health and Wellness Center, for example, Tim Glockner's been up to a class, right? They have, the client population has no idea that he is like the head person in charge of the 7th-generation longest operating Chevrolet dealer in the United States. You know what I mean?
Right.
All they know is Dale told him that he brought his friend Tim up and that Tim's not very good at CrossFit and to be nice to him. You know what I mean?
Yeah.
And it's just like they have no clue in it, and that's the cool part, is like it doesn't matter, right?
Bernard Glockner died in 1876. It is recalled that the funeral cortege was the largest ever seen in the city.
This is the Local Legends Podcast.
Welcome back to the Local Legends Podcast. This is episode 40, and I'm sitting here with Andy Albrecht and Max Liles in the Speakeasy. Welcome, gentlemen.
Thanks, man.
Thanks for having us.
Yeah, glad to be here.
Start by just introducing yourself, and we'll get into it.
Go ahead.
I'm Andy Albrecht. I'm the CEO of the Counseling Center.
Sure. My name is Max Liles, Senior Director at the Counseling Center, do clinical supervision and other things that Andy tells me to do.
Fair enough. Max had texted me out of the blue here, and we wanted to kind of discuss a few things. One, like vision cast, what you guys are doing for the future.
Yeah.
Because just knowing a little bit about what you all have accomplished already and where you're going, I am personally super excited.
Yeah.
And the recovery efforts that the team at the Counseling Center undergoes and how it affects the community is significant in a number of ways. You know, they're not separate universes here. There's not like the recovery universe and then just the regular public. Everything is intertwined to our just overall success. So what you guys are doing is important, and I appreciate you guys taking the time to talk about it a little bit.
Appreciate it.
Dude, total pleasure.
I did a little bit of a throwback this morning and reviewed that Boston Globe article from 2019.
Yeah.
Cool. They really do a great job. The journalist does an amazing job at painting this vivid picture of the East End, whipping through, 7th Street, 8th Street with Dale on the 1940s Willie.
Yeah.
And my wife and I lived on 3rd Street, 3rd and Brown for a while at this little apartment complex called Magnolia Court. Yeah. And, we walked to the Blue Store during the summer. We had friends that lived on 7th and Campbell. And wherever you are downtown, there's this giant looming building from the 19th century, which is Soul Choice. It's very hard to miss. It's people still associate that with that building. It has a lot of symbolic meaning for what Portsmouth, quote unquote, used to be. Sure. Right. And now you all are operating like Andy. You're there daily. And Soul Choice has become, the Counseling Center has taken it on to be kind of like this new heart for your all's organization and represent a lot of hope for the area. So how did all of that start? That's a really powerful project.
Well, how that project, there's a little bit of story kind of behind the story on the Mitchell Ace building. When, over the years of the Counseling Center, we've grown a lot, we've changed a lot. Part of our mission is to make sure individuals in our community have access to treatment when appropriate. So we've kind of held our feet to the fire to make sure people have access and able to, enter treatment whenever they need to enter treatment. So through all this growth over the years, we kind of behind the scenes had been talking for a while about well, maybe we should kind of reconfigure the agency. Maybe we should look at something bigger that has a bigger impact on the community. And we had talked about maybe forming a campus of sorts, just just similar to a college university thinking or a hospital thinking. It's you grow to a certain point and maybe it's time to consolidate some things and make things in a campus. So originally we were looking at some property down around the East End, and my initial thought was I was actually sitting in Port City Cafe with Tim Wolf. We were having lunch, and I didn't know Tim at the time. This is several years ago. We were sitting there eating lunch, and I remember I asked Tim, how can we buy a street, an entire street in the East End, and maybe possibly build a campus on that part of town? Of course, he perked up at lunch, and
his wheels turning, didn't it? Yeah.
That's all you need to do to that dude is pitch a crazy idea.
Tim was excited, and like we didn't even hardly eat lunch. We just kind of talked through that, and kind of one thing led to another. Next thing we know, we ended up looking at the Mitchell Ace building about potentially not buying a street, and just looking at what would it be to possibly purchase that building and renovate it. So that kind of led us down that path of exploring that option. Of course, one thing led to another, and we ended up purchasing the building.
Like, when did you start to hear the idea, Max?
I don't know, like when the idea of the campus has been one of those things that's been talked about for a couple years at this point. And the details of kind of our vision develop and continue to develop over time, right? With like what we like want to do and are trying to do. But I don't know if it's, and there were a couple different locations too. It's like, there was like some larger scale properties available like by the stadium, and then we'd even talked about Franklin Furnace at one point in time, but just, you said it, dude, you go anywhere in Portsmouth, you can see the Mitchell Ace building. Right? Like, it's the big white whale, dude, right? And it's the thing that has been capitalized by major media up until 1819 when we start to get some positive press about things that are going on in Portsmouth, right? Like, major media outlets have capitalized on that building to, like you said, like show what's been going on, like how Portsmouth has demised, and that's like the depiction of that, right?
Right.
And so like we'd been talking about the campus project for a few years, and then the details have grown. And it's just what makes sense for the model. So like I was in a class at Shawnee State talking to some social science majors about the behavioral health field and how they could leverage their degree to like get involved if they want to and those kind of things. And I realized when I got to a slide that it was an old presentation because it said that we had 30 plus site locations. Well, that number's grown to like 40. And then like that we had 300 plus employees, and that number's grown to like 400. And at first I was like, I gotta update my slides, you know what I mean? But really it's like we've only grown, like Andy said, because of the need for access.
Right.
We're not like, the counseling center is a nonprofit agency. There's no owner. We have a board of directors. The administration works for the board. There's nobody there's no single person collecting money at the top of this thing. But it's a need. That's why we've grown this big, right?
Right.
So it's like our model. We have one of the most comprehensive models in the state of Ohio. Can literally take people from acute detox situations, like where people are like coming off the street from actively using, all the way to like outpatient long-term mental health therapy, vocational rehabilitation, jobs, people getting in homes, like productive members of society stuff, right? And we operate the most comprehensive model in the state just as inefficiently as you could possibly imagine, right? So it's like, well, SOMC's really big, right?
Yeah.
Shawnee State's really big, right? Why don't they have 40 locations spread out across 4 counties or whatever?
Sure.
It just doesn't make any sense. It's inefficient, right?
Yeah. And you guys have been just growing at such a rapid pace and are so multifaceted that it's probably just hard to keep up and consolidate, like you're saying. But Andy, everybody knows that the building is big. Like, the building's very recognizable. Yeah. But then I forget who was just describing to me like what the building contained, the rooms, windows, things like that. And when you start to like verbalize it, it seems really overwhelming, like the project in itself.
It's a 365,000 square foot building.
I can't even compute that in my head. You know what I mean?
Just as a comparison, like, we have a lot of people refer to it as the old Scudder School building downtown, which is 411 Court Street. And that's about a 50,000 square foot building. So if you take the Scudder School building and stack 7 of those on top of each other, that would be approximately the Mitchell Ace building.
Wow.
Yeah. So like what is kind of known as our flagship location in town, which is the Court Street building that says the counseling center real big across the front of it. We're gonna take 7 of those and stack them on top of each other.
Right.
But as Max mentioned, though, I mean the services that we're going to move into the Mitchell Ace building, the reality is we've already developed all of those services. So even though that building is a monstrous building, seems overwhelming, it's like, oh my gosh, like how do you plan all this, service and stuff for clients inside that building? It's like, well, the reality is we've kind of already got it. It's just we've developed it so quickly and so fast over the years that it's just it's spread out.
Sure.
Well, yeah, and with that said, what do you think the potential impact will be of having all your services consolidated in the heart of the city like that, where it's so visible?
And that's been we've released like some, we've got the announcement of the project's been live. There's been press releases about our intentions with the building and what we're going to do, and there's been a lot of positive buzz around that. Like this will be the largest redevelopment project that's ever happened in Portsmouth, and we're going to do it in the East End. Right, like the place that's like like that nobody wants to go. Right, we're going to redevelop that part of town, and so. But I think there's also been mixed reviews in that like a project of that size, of that magnitude, with the population that we deal with, I think is scary to people that don't know. Right, there's some fear based around that.
Oh, absolutely.
And I think that stems from. People see how big the agency is, they see how big the counseling center is, and they think that in addition to all the things that we already do, that we're also going to operate it in that building as well, in addition to the stuff that we already do, so that we're going to grow that much. In reality, what we're doing, what's the impact? The impact's going to be better care for clients that come through, more centralized care, more efficiency for clients and staff, right? It's going to result in a little bit more access, right? But it's going to really increase our quality of what treatment looks like.
Right.
So it's like, rather than really an expansion project, and it's like, oh, the counseling center is going to get that much bigger. Really what it is, the counseling center is going to get that much more efficient. We're going to do a better job with the things we already have. To Andy's point, we already operate all these programs. The withdrawal management program that's in Franklin Furnace is just going to be in that building at the main campus now, right? The residential program that's in Franklin Furnace is just going to be in that building now. All the various treatment that happens at Court Street, where it's not new stuff, we're just going to do it centrally located, right? We're going to have all our resources centrally located, and it's that hospital model, campus model. That's that Andy was talking about at the beginning.
What's really cool about this project is that this is going to be a totally one-of-a-kind project.
Right.
So as we talk about this, as we develop it, as we move forward on the project, there is not a facility that exists in the state of Ohio like this, and maybe even in the United States. You think about historically how drug and alcohol, mental health services have been operated within a community. It's not under one roof. It's very disjointed. It's very fragmented. Hospitals are very good at this. You go to a hospital, you can walk through the front door of a hospital and you can get anything from a cup of coffee to major heart surgery.
In the same building.
In
the same building.
And they have the wraparound services there. Universities are set up like that. You can take your biology class and get a meal and live in a dorm.
And then get tickets to the football game.
Yeah.
You know what I mean? All in the same place.
So with that type of thinking, that's kind of how we envision this project, this campus project, where someone that's addicted, has a mental health problem, whatever those issues are, they can walk in that front door just like a hospital, and we can, you might need crisis intervention, you might need detox, you might need residential treatment, you might need a hot meal, you need a place, you know what I mean? So for us to be able to kind of orchestrate all that within a campus setting versus like, well, we're going to run Max out to Franklin Furnace because he needs detox. And
you need another gas card this month.
Yeah, no doubt, right? Well, and another couple cars like Plug Lochner, you know what I mean? Like, can we get another 15-passenger van? You know what I mean?
Yeah, it's like.
But
it's just so inefficient.
Man, and that's a really powerful intention, just to bring all it, I like to use the word fragmented, just to kind of regroup. And, Tim Wolf bringing his name up again very early on in the podcast, he was talking about how another really amazing intention about this is rehabbing one of these historic buildings specifically, and such a large one, because it just sends a different message than throwing up like 4 brand new walls kind of thing. You know what I mean? You're like investigating every brick and taking this building that has a story behind it that stands for prosperity, and just really bringing that back. Really cool. So as far as I know, man, like I said, the counseling center in general, just naturally, just by the nature of recovery and what that looks like for people, is extremely multifaceted. So along with this project, what else are you guys excited to tell people about that the counseling center is doing?
Yeah, you want to queue up the so one of the things that we just got to do recently is we've got to spread our wings a little bit in Lawrence County. So historically, the largest portion of the counseling center's operations always been in Scioto County. Right. And then we've also have a gosh, how long has Adams County been in operation at this point?
About 25 years.
I was going to say 20 plus years. So we've always kind of had a presence in West Union, and that's developed, and they serve 50 to 60 clients at a time out within that sort of out within that area. So it's like with this idea of like increasing in efficiency, because from the outside looking in, you're going to say that, well, the counseling center is a successful business. It's been around for 40 years. It's gone from a house and 3 employees, right? I love it when you describe it as, well, there was the executive director who was also a counselor, and then there was one other counselor, and then there was a girl that answered the phones. And that was the counseling center in 1980, right?
I love it.
So then fast forward 41 years, right? And we've got 400 employees and all these...
460, actually.
460
Wow.
employees and all these different levels of care and all these different programs and support things for youth and moms with kids and long-term care and transitional living and vocational training and all this stuff. It's like, man, that's a successful business, right? But we still want to challenge ourselves, like do more, do better, right? How do we further impact the community? So,
Well, the need is there, yeah.
oh,
like you're
absolutely,
saying. Yeah.
absolutely.
Well, and the cool part of what we're doing, like, he asked the question, like, well, like, what's the future look like? What do we plan on doing? The cool part is, like, everything we do really is just based on what the clients tell us we need.
Yeah.
Like, that's the magic in all this. Like, the clients tell us what they need to be successful.
Right.
It's just up to us at that point to develop it for them.
Yeah.
So in some ways, even though we're doing all this planning, we might not know what the client need is like a year from now, 2 years from now.
Yeah.
They've told us things historically, like they need daycare, they need transportation, they need healthcare services.
Yeah.
And those are just the things that we've just really tried to work really hard and develop for the client, because again, that's what it's all about. When that client reaches out to us and they need help, do we have the services kind of ready to go to make that person successful long term?
Yeah.
So the main campus will continue to, I believe, give us flexibility to meet client needs as they arise.
Yeah.
Like, we by no means, like, you think about the way the opioid epidemic, like, that's a buzzword and has been a thing for 20 years at this point, right? Like, we were one of the first, like, places to start using that language, calling it an epidemic and those kind of things. But you think about the way that even that problem's changed and evolved. We've gone from Oxycontin and doctors and pill mills that got taken away, to heroin, to then now fentanyl, carfentanil, the synthetic opiates, right? So for us, methamphetamine now making a resurgence, right? So it's like, for us to think that we can like plan for the future that we know is going to happen,
Right.
it's kind of like a cool story, bro. You know what I mean? Like, we don't really know necessarily, but I think the new model and the way we're looking at doing the things give us some flexibility, right? So the Lawrence County project. In looking at how do we better serve the other pockets of the community that maybe aren't as densely populated as Portsmouth, or don't have the established providers like the counseling center that's able to be a regional provider.
Right.
So we're looking at adding in a small residential facility up there. We're going to have some for people that in that community that need front end care that are residents of Lawrence County, but then really focusing on that back end of treatment where a lot of people drop the ball and don't really pursue providing people with supportive housing while they're in outpatient treatment, and then also just serving the community, like the people that live in Ironton within like walking or riding distance that can come in and get the services that they need, right? And that's all those different things from your traditional things you think of with the counseling center, substance use disorder treatment, behavioral health treatment, but then also primary health care, access to the gym, the health and wellness center, like every little, like there will be a gym in the Lawrence County facility, right? So that's something that we're excited about, just to be able to branch that model out to those other places.
Right.
That that's the community's kind of told us what they want to see. And there's the storyline of, well, if everybody took care of people where they were from, everybody wouldn't have to come to Portsmouth, right? Well, one of the ways that we can support that is to have some resources in those counties,
Right.
Because the counseling centers, we're a regional provider. We're not a Scioto County provider, right? The resources that we have are a total anomaly in a rural community like Portsmouth.
Sure.
Total anomaly.
Sure, yeah.
To find anything this size, you're going to have to go to Cincinnati, Columbus, Cleveland, right?
Yeah.
So we're a regional provider. So, well, why can't people come and why do you have to come to Portsmouth to get what you need? Well, resources aren't distributed evenly. So a person who's using in Vinton County that needs withdrawal management or crisis intervention services,
It doesn't exist.
it doesn't exist, right? Vinton County's a food desert. There's not even a grocery store there, but it's like, but the community would prefer that, well, if that person is struggling, substance use, mental health, whatever, well, why can't they get treatment where they're at? It doesn't exist. So what we're trying to do as part of our strategic plan is to get some pockets of satellite campuses, keep going back to the hospital university model. There's Ohio University, go Bobcats, and then there's OU Southern, OU Lancaster, OU Chillicothe, right? So universities are set up that way. So we've, while we'd like to say that we came up with this thing on our own, and we've just kind of ripped off the idea of that stuff and moved forward. Yeah.
Plus, we've always had just a different approach treatment-wise, I think, to serving our region. For example, just to give an example, if a female would call us that's pregnant and using, it's in, not very good shape, maybe 3-4 months pregnant, and there's maybe a small child that's with the mom, like a 1-year-old. The 1-year-old might also be at risk due to the substance abuse in the family, and that mom lives in, say, Piketon. Well, we don't say, I'm sorry, you live in Pike County. It's Piketon, it's 20 minutes away.
Right.
Like, what can we do to help that individual?
Yeah.
That individual might need a Stepping Stones program that's here in Portsmouth.
Sure.
Well, that program doesn't exist in Piketon, that's 20 minutes up the road.
It doesn't exist almost anywhere else in the state.
Yeah.
Like we're like historically, that's one of the reasons, that I love working for the counseling center is historically the agency will assume the risks that nobody else wants to try to meet people's needs. A pregnant mom's a liability that's using. You bring her kid in, it's even more of a liability. But it's like, what's that person supposed to do?
Yeah.
Right? Well, what we would like them to do is like come to Stepping Stones, let us manage their case, give birth to a drug-free baby. That'd be we're at like 340 healthy kids that have been born through that program since its existence. It's like a lot of people won't touch that because it's like, man, that's heavy, right? But the agency historically stepped in and done the stuff that nobody else will.
Well, and that's really like what has kind of prompted me to get behind you guys is I love this holistic approach that you take.
Yeah.
It's very people-oriented, very, like I said, multi-dimensional, where you're considering physical health, just family situations, and really finding ways to transcend literal boundaries like Pike County, Scioto County.
A county line. Right?
Yeah. So, it's super powerful, and I think just adding, this hospital kind of model to that is another facet of it. But so Lawrence County, what you guys are doing with the Soul Choice building, is there anything else that you guys you have in the works among all these things?
Well, I think we're always looking at like housing opportunities for individuals in recovery.
Yeah.
I went to a strategic planning meeting about 2 years ago at PMHA, and I sat in that meeting, and there was 1,400 families on a waiting list.
Families,
Wow.
not individuals. Families.
So, you go into any community and you just ask the community just simple questions like, do you have safe, sober, affordable places to stay? And it's like, the answer is no,
Right.
So I think that's one of the things, as Max mentioned, like taking risks, like, that's something that we're kind of always looking at, like how can we do a better job, providing safe, affordable, cheap housing for people that's in recovery. I mean, if someone graduates, say, the Marsh House, and, you're 90 days sober and you don't have a place to go, if there's not that next step
Right.
for that individual, then
Sure.
those outcomes get very diminished.
And I mean, Charlotte Gordon was just talking on the podcast last week about just creating spaces for all kinds of different voices and lifestyles, things like that. And it is the that concept really manifests itself in real estate and things like that you guys are talking about. It's that exact same kind of thing. If people don't have places to go or a place to feel welcome, safe, sober, then it's a very short story, like you're saying.
Right. Yeah.
People, that's one of those questions too. Will get asked about, like, what are what's the success rate of behavioral health treatment or whatever, and those kind of things. And it's a difficult question to ask because a lot of times what happens is successful outcomes aren't able to be measured all the way through because a person stops the treatment protocol before we wanted them to.
Right.
Similar to, like, if you had cancer, right, and you went in and the doctor said, hey, we need you to do XYZ radiation, and then after that we need you to do ABC chemotherapy, and then we're going to need you to follow up with a doctor for the next 5 years and keep track on, like, you're going to have monthly, 3 month, 6 month scans that are going on, right? And they're going to measure a successful outcome at like 5 years post-treatment, right? A lot of times with the way that treatment's been historically operated is like, well, Andy, you need to go to the Marsh House for 90 days. And then after 90 days, we're going to pat you on the back and we're going to say, go see your PO and don't drink, right?
Pretty much.
But it's like, now it's like we are able, with this continuum of care that we offer, right, is we can manage people's physical withdrawal. We can give people time to physically stabilize in some of these front-end residential programs. We can do things like on the back end to allow them to start to take on life's responsibilities a little bit at a time until they're ready to get in a situation where it's like, okay, I'm going to rent my own place. I'm going to buy my own place. And supportive housing past that super intense part of residential treatment, right, is going to be better. The real successful outcomes come when people are able to go from front end to aftercare in one place with no interruption of service.
Right.
Yeah.
Right? And it's like, well, what's the success rate? It's, well, the counseling center employs 460 people, and 2/3 of those people are individuals that identify as being in long-term recovery. So there's a few hundred examples right there, right? So, like, and then of the other providers that are operating within the region, we have alumni that work at those places too, right? So, like, recovery's been realized by so many people locally that's hard to combat the narrative that, like, well, this stuff doesn't work or this stuff isn't meaningful, right? What's meaningful is when people can go from start to finish in one place.
I guess my question is, and I know this is like a continual process to bring other people into understanding your continuum of care, but
Boy, is it.
Yeah.
You know what I mean?
but how have you guys just taken steps and put out content, and what work do you think needs to be done to help people understand that recovery equals social change, cultural change, economic development, etc. I mean, I think it's just gradually been happening over time, especially with the projects that you're taking on.
Yeah.
I mean, you're literally transforming real estate and in the community. So, but I want to hear that answer from you all.
Talk a little bit about the behavioral health redesign and kind of the way that, like, things were, like, before it was super simple, right?
Yeah, I mean, a couple of years ago, the state of Ohio changed drastically, right?
Drastically.
So the whole entire Medicaid system changed in the state of Ohio. So for years and years and years, actually forever,
until January 1, 2018, everything back from that has been super simple process.
Yeah, so like drug and alcohol treatment was carved out of the medical system. So like you almost had two tracks of Medicaid services in the state of Ohio. You had medical services, which is like all your hospitals, nursing homes,
primary
urgent
health
care,
care things,
primary
that you would
health care.
think.
And then you had drug and alcohol services that was carved out. So those services like never talked to each other. They were two different billing tracks.
Wow.
And
two different treatment protocols, like no doctor gave input to a person's substance use or behavioral health care.
The managed care insurance companies, like say a CareSource or Molina, was not linked into those carved out Medicaid services. So like it was so simple back then. And we're talking back then as in like 2018.
Not like prehistoric times.
Yeah, like this isn't like 1940.
Yeah, right.
So like I always like kid around people. It's like I could go inside a Walmart and walk up and down the aisles and just bring people to treatment.
Yeah.
And there was no really system in place. You know, you can't do that in the medical world. I don't go in Walmart and say, I'm going to have surgery on you. You know, I mean, there'd be like insurance companies and approvals.
I'm surprised, actually, that that's not a thing.
Well, you might be able to do it somewhere like in a basement or something.
Well, yeah, speaking of the basement,
maybe
right?
in
Maybe in the
here,
Glockner speakeasy.
Yeah.
But so I mean that drastically changed the entire system. So you know, it's brought, you know, some level of like accountability, professionalism.
Yeah.
And again, that's only been a couple of years ago, right?
So it's like the simple times Andy's talking about. You go to the admission center, or you call the number, the admissions number, and say, you know, I need help, right? And they'll say, okay, come in for an assessment. And then from the assessment, you either went to inpatient treatment or you went to outpatient treatment. And we were the experts on where you were staying and for how long. That's a super simple continuum of care to explain to somebody, right? It's like, well, you're going to go to the Marsh House, or you're going to go to Stepping Stones. And, well, when am I going to be done? It's like, well, when we say you're done.
Sure.
You know, whenever you've progressed to the point that we feel comfortable saying, you know, go forth and good luck kind of deal, right? So this new in addition to the Medicaid and the billing dollars changing and the pathways of what that looks like, right? The treatment tracks also change. So now you can come in and you might be referred to medically monitored withdrawal management. You might come in and be referred to residential treatment. You might come in and be referred to clinically monitored withdrawal management. You might come in and be referred to partial hospitalization, which is like a day treatment program. Or you might come in and just be referred to an outpatient program or a transitional living program. Or you might come in and we say, hey, we don't offer a service here that might benefit you. You need to go to a hospital, right? It's like, so that's before it was like, well, you got one of two options. And it was
outpatient or inpatient.
And at that point, it was probably whatever you get the client to agree to to do. Yeah. There was no, you know, it's but now it's all these systems and all these different, we refer to them as levels of care. So complex, very similar to a hospital with your, you know, your ER and your ICU and your general admission and outpatient services and various tracks of that. It's just a super complex thing to be able to try to explain it in a community or in a region where there are nearly 50 other behavioral health agencies in operation, right? Where people lump all that treatment in together as the counseling center. Any treatment program is the counseling center to like your
layperson.
Oh, sure.
To a layperson,
right.
Yeah.
So to try to explain that there's actually 49 other people in operation and we don't have anything to do with them. To then try to explain the layer of like what we're actually trying to do, because what we do now is considered specialty healthcare. Managing behavioral health is considered specialty healthcare. So trying to explain what all's contained in that continuum to a person that just knows that they don't want an unsupervised house of 16 individuals in early recovery living in their residential community. Right. There's a disconnect. We're on different levels, right? So it's, I mean, one thing has just been to constantly put the things that we do in front of people. Social media is great for that. You know? Follow us on Facebook. Like us on Instagram.
Plug.
Yeah.
But I think one thing that really has set you guys apart and that you're doing really well is just the storytelling element of what's happening at the counseling center. You know, you already incorporate these more and really unique kind of human elements to the nonprofit, which is things like the Hawk, right?
Yeah,
and
sure.
Physical fitness, CrossFit classes.
Our garage, our TCC garage.
Right,
How
the
cool is that?
TCC garage is awesome. What's Tyler and his brother's last name?
Dave Paul, and
Yeah,
Tyler Paul.
man,
Yeah,
I
they
hear
operate
about
the
them.
Shout out to
Yeah.
the Paul brothers.
I hear about them all the time because
Yeah.
they're just wizards underneath the hood.
Yeah, for sure, man. Of any hood, right? Or
right.
any engine, as a matter of fact. You might go over there and see a
Jet
speedboat
ski
or a
or-
jet ski or a four-wheeler.
Yeah.
Or a,
But out of those more human elements of what you guys do just comes these amazing stories of personal development and people that have made massive comebacks and just have stories to tell. I mean, they're coming from oftentimes really low places on to do incredible things, right?
Yeah.
And so, Max, I know you are working on a project,
Yeah.
a storytelling project. No, tell us a little bit about that and what to expect.
Yeah, man. So this is something that, and the story of the counseling center is the stories of the people, right? You know, like now with this modernization of like Medicaid and the service line, it's gotten more centered around formal education and going to get licenses and degrees and things like that, which, like, you know, we have people that are willing to do that, and we're fortunate, right? But the story of the counseling center is really about the guy or girl that got clean and then decided they wanted to work for the agency and help people.
Sure.
Right. And so we've been able to tell a lot of those stories, and kind of being, you know, born and raised in that environment myself, right? Like as an alumni of the counseling center, that's been something that's important to me, is like, how do you tell, so like talking about the continuum of care, right? So how do you tell people or educate people or expose to people certain topics or stereotypes or ideas that they might have about drug addicts, right? And then educate about the things that, you know, like, well, really, there's, you know, let's tell you this person's story to talk about some of those things, right? So the project, a little side gig, Not Your Average IV User podcast. We've got 9 episodes recorded right now. It is the opposite of the Joe Rogan experience in that it won't be 4 hours long. It'll little 30-minute bite-sized things that you can listen to on the car on the way to work or while you're eating lunch or whatever, but really centered around just that, right? Trying to do 2 things. Number 1, continue to tell stories of local people in recovery, but then also address some of the things like stigma, educate people about the disease model, the thought that drug addicts are lazy looking for a handout, right? We're going to try to address a lot of that stuff through the podcast, and just like I said, continue to expose what that looks like and what people's true experiences are.
Man, that's awesome. And I think the local element is super important. People knowing that the people they're hearing from are coming from the same place.
Yeah.
It's contextual to them. They understand that they could potentially overcome the same thing, or just really how to be in community with people from the recovery community is a powerful thing.
And that's you bring up community and the Hawk. For a long time, recovery's existed in a bubble, right? It's like, and partly our own making. We find our tribe, we keep each other safe, we feel comfortable around each other, right? Yeah. You know, part of the mission of things like the Garage and the Health and Wellness Center and our partnerships with like Friends of Portsmouth, and we were just up with Friends of Greenlawn last week doing some community service stuff, is like we want to integrate the recovery community and the regular community at large, right? Like we want people to have the ability to go in and out of that bubble, right? And so we found a lot of allies, man. Like there's a lot of people that are interested in spending time with our people.
Yeah, when you think about like outcomes, like the ultimate end game, like the outcome is like, you know, you talked about like, you know, when people ask like how successful you are and stuff like that, it's always so hard to, you know, answer that question.
I always feel like I go into like a 30-minute rant.
There's a lot of there is a lot of qualitative data, not just the quantitative, how many people went through, you know, because that's
like how many people did you admit, how many people graduated, you know, blah, 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 blah.
Sure.
But really, ultimately, if you think about the end game in this, like an outcome would be like, did we get that individual reconnected and re-ingrained back into the community?
Sure.
You know, and it's like just that is like such a tall order.
Yeah.
You know, so this individual might not have any family. They might not have a driver's license. They might not have a job. They have a substance abuse disorder. They've got, you know, children they're trying to reconnect with. So it's like
they're depressed because they don't have any of that stuff.
You know, so some of these partnerships that Max is referring to has been huge for us, you know, being able to help out with a, you know, Friends of Portsmouth group, or, you know, when the Christmas events are going on, like, how do we get people, you know, energized and like just actually ingrained into that, you know, it makes them feel better. You know, we've had clients go down there to work and they're almost kind of scared, like antsy, like people's going to judge me or I'm different. And it's like getting them involved in that stuff, super powerful on both sides of the fence.
Yeah. And I feel like that's part of my life's work as a professional, is to get groups of people in spaces together that would otherwise like never share them. Right. You know what I mean? So like the Health and Wellness Center, for example, Tim Glockner's been up to a class, right? They have the client population has no idea that he is like the head person in charge of the 7-generation longest operating Chevrolet dealer in the United States. You know what I mean?
Right.
All they know is Dale told him that he brought his friend Tim up and that Tim's not very good at CrossFit and to be nice to him. You know what I mean?
Yeah.
And it's just like they have no clue in it, and that's the cool part is like it doesn't matter, right?
Right.
Josh Sherman from the fire department has been instrumental in helping
Shout
us.
out, cuz, bro.
Yeah. And instrumental in helping us line up our quick response team, where we have staff members that respond with his EMS to overdose calls, right? To try to take out the middleman and navigate in the hospital system, right? He'll run over, work out, and then run back to wherever he ran from. It seems like a lot to me, but whatever.
Yeah.
But yeah, like to come like spend time with people, man, right? And to be able to be involved in these regular community events with, these people, individuals start to see that like, well, no one knows. You can't just like look at a person and be like, oh yeah, that person's got a substance use disorder. If somebody's actively in a mental health outbreak or actively using or intoxicated, sure, you can tell then. But it's like you can't tell if a person's in early recovery or not.
Yeah.
And to be able to let individuals in early recovery experience those things with people has been beneficial.
Yeah, and I know, man, you guys are doing a lot of powerful work that, like you're saying, Andy, affects both the recovery community and the general public alike. That they're synergistic, right? And we're going to really, very literally rise together through these kind of things. So,
Yeah.
Well, yeah. What other do you guys have any exciting ideas moving forward? You're sharing a lot of awesome information, but as far as like ideas that like continue to affect the community as a whole, I mean, what are you looking forward to? And how could people that are hearing this, that are interested in what the counseling center's doing, potentially get involved?
Yeah. Well, one thing I think is probably worth noting. And I'll let Max talk about this because he's firing this back up, is our loved ones group.
Oh yeah, man, that's a thing. I'm glad you brought that up.
Ed Hughes, our former CEO of 27 years.
Just a bit of time.
Just a little bit of time.
Yeah, Ed was the executive director for a little while.
Yeah,
Absolute legend, man.
Just for a couple of years, He started a loved ones group when probably 15 years ago, probably. Or so.
I would say at least, at the beginning of the opioid epidemic when we started seeing some of the real true effects of what, OxyContin was doing. I think he started that.
If you want to talk about that.
Yeah, man. So Loved Ones is one of those programs that my mom had a copy of the Loved Ones DVD before I ever did my first OxyContin, and I believed, looking back, armed her with some tools to like help raise my bottom that I eventually wanted help. What she deepened my dilemma.
Deepened your dilemma, Max.
And I needed she created the need for change by some of the things that it taught her. And so then we listen to the community, we hear what people say, and one of the criticisms of the local community is that there's all these treatment centers and all these access points and resources for people who are using, but there's nothing for families. Right? So turns out we have a program for families. It was just kind of dormant, right? Ed had kind of pioneered that thing, and I think at one point told me he had 15 loved ones groups that operated within the region, some of them even in Kentucky and West Virginia.
Wow.
I'm back to one. We have one that operates right now, and it's every Tuesday night at the Day One Center on 4th Street, right across from the municipal lot there. We're on the second floor. Shout out Holly Gale, who's also been local legends guest. Man, yeah. Holly recorded us a commercial, and it's running on WNXT right now. And then we post about that on social media a lot as well, just trying to increase the community involvement with that. It's free. It doesn't matter if your loved one's actively using. It doesn't matter if your loved one's incarcerated. It doesn't matter if your loved one is in treatment with the counseling center or some other treatment agency. It doesn't matter if your loved one's in long-term recovery. We're not going to ask for your insurance card. We're not going to make you pay to come. It's a free community resource that we just believe in it, right? We believe that if people know better, they can do better. And so we want to increase people's working knowledge of what the disease of addiction is, and then what families can do to help support their loved ones that are going through any level of that experience. Yeah.
Well, yeah, absolutely super powerful. And I think, unless you're breaking down your own personal barriers as someone, as a bystander in the community and actually getting in and meeting people, then we can't really completely move forward, or you're never going to understand the purpose of the continuum of care or have a context for it. Right?
Sure. Yeah, for sure.
Well, yeah, gentlemen, thank you so much for your time, and you're doing things that are affecting real people fighting back, and yeah, we appreciate your work here.
Appreciate it.
Thanks,
Appreciate
dude. Thanks for having us.
Yeah.
And don't forget, like us on Facebook, follow us on Instagram, The Counseling Center. Super easy to find.
Yes. Take care, everybody. Thanks for
Thanks.
listening.